This medication helps relieve discomfort, pain, frequent urge to urinate, and cramps/spasms of the urinary tract caused by an infection or a medical procedure. Methenamine and methylene blue prevent the growth of bacteria in the urine, while salicylate is a pain reliever. This product also contains an ingredient to make the urine more acidic, which helps methenamine work better. Hyoscyamine relaxes the muscles of the urinary tract to relieve cramps/spasms. It should not be used to treat a urinary tract infection. If you have a bacterial infection, consult your doctor for more details. This medication is not recommended for children younger than 6 years because they are more sensitive to the side effects. The recommended daily dosage and optimal timing for taking this medication should be determined by consulting with a healthcare professional. When taking Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule urinary antispasmodics, it's important to follow your doctor's instructions. Typically, you'll need to take this medication 4 times a day with a full glass of water. After taking it, make sure not to lie down for at least 10 minutes. It's also recommended to drink plenty of fluids unless your doctor advises otherwise, and if you experience any stomach upset, you can take it with food. The dosage will be determined by your medical condition, age, and how you respond to the treatment. It's crucial not to increase your dose or use this medication more frequently or for a longer duration than prescribed. Taking antacids may reduce the absorption and effectiveness of this product, so if you're also using antacids, take this medication at least 1 hour before them. To ensure the best results, take this medication at evenly spaced times each day. Be cautious when consuming caffeine while using this medication, as it can increase the side effects. Try to avoid large amounts of caffeine-containing beverages and products, such as coffee, tea, colas, and chocolate. If your condition does not improve within a few days or if you experience signs of a urinary tract infection, be sure to inform your doctor. If you experience nausea, vomiting, dry mouth, dizziness, drowsiness, blurred vision, or constipation, it's important to let your doctor or pharmacist know. To help with dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. This medication may cause your urine and sometimes stools to turn blue-green, but this is a harmless effect that will go away when you stop taking the medication. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks of potential side effects. However, if you experience any serious side effects such as hot/dry/flushed skin, decreased sweating, eye pain, difficult urination, or signs of kidney problems, it's important to contact your doctor right away. In rare cases, this medication may cause an extremely high blood pressure attack, which could be fatal. If you experience severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweaty/clammy skin, widened pupils, vision changes, or sudden sensitivity to light, it's crucial to seek medical help immediately. Although a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Before taking Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule urinary antispasmodics, make sure to tell your doctor or pharmacist about any allergies you may have. It's also important to discuss your medical history, including any kidney, liver, or urinary problems, as well as any heart conditions or high blood pressure. This medication may cause dizziness or drowsiness, so be cautious when driving or using machinery. Avoid alcohol, marijuana, tobacco, and excessive heat while taking this medication. Additionally, it's important to inform your doctor about all other medications and herbal products you are using, as well as if you are pregnant or breastfeeding. This medication should not be used in pregnancy after 20 weeks, and it can have negative effects on a nursing infant. It's important to be aware of potential drug interactions when taking Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule urinary antispasmodics. This medication may interact with a wide range of products, including certain high blood pressure drugs, Parkinson's disease drugs, and products that decrease the amount of acid in the urine. It may also increase the risk of bleeding when taken with other drugs that may cause bleeding, and should not be taken with MAO inhibitors. Additionally, it's important to report the use of other drugs that may increase the risk of extremely high blood pressure when combined with this product, as well as azole antifungal drugs. Finally, Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule urinary antispasmodics may cause drowsiness and interfere with certain lab tests, so it's important to check all prescription and non-prescription medicine labels carefully and to inform your doctor or pharmacist of all other products you are taking. If someone has taken too much Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include fever, rapid or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. It is crucial to seek medical attention in case of an overdose. This medication is not to be shared with others. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Uro-Sp 118 mg, 10 mg, 40.8 mg, 36 mg capsule urinary antispasmodics at room temperature and away from light and moisture. It's important to keep them out of the bathroom and out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you've been told to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this in a safe and environmentally friendly way. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.